Hello, I'm Dr. Padma. I'm a geriatrician from Newcastle, New South Wales. My special interest is older persons with Parkinson's disease. Many thanks for the Professor Benjamin Foundation for this very kind invite, asking me to talk uh, for the World Brain Day. Um, Parkinson's disease is a condition where it is very difficult for us to prevent the condition. However, there are aspects of the Parkinson disease which are modifiable or preventable to a degree. I'm talking about falls in an older person with Parkinson's disease. Falls is an important problem because elderly people are afraid, they have sarcopenia, and by their age itself, they stand a very high chance of having a fall. As we all know, having a fall means injury, fractures, comorbidity. Hence, we should do whatever we can to prevent an older person with Parkinson's disease from falling. The biggest problem in falling in older persons is the fear of falling. That is the most important risk factor that we need to address. Parkinson's disease per se can increase the chance of a person to fall. It could be bradykinesia or a freezing of gait, the gait span, the clearance of the ground from the when they're walking. All of them can produce stumble and falls. Parkinson's disease medication can drop the blood pressure. The condition itself can drop the blood pressure, and postural hypertension is a big problem in persons with Parkinson's disease, which can trigger a fall. So keeping oneself very much hydrated, drinking lots of water, using compression stockings, avoiding sudden postural changes, etc., can reduce the risk of fall in persons with Parkinson's disease. The other important factor which makes a person fall in Parkinson's disease is impairment of postural reflexes. When we stand, there is a center of gravity which is maintained by the reflexes coming from multiple joints and the posterior column. That is unfortunately impaired in people with Parkinson's disease. So postural changes, sudden bending or leaning over should be avoided. So that's another important factor which makes someone with Parkinson's disease fall. Physical therapy, making one aware of the situations, a good occupational therapy input is very much valuable in preventing the fall in Parkinson's disease because of postural reflexes. Now, getting up multiple times during the night to pass urine or nocturia, that increases the fall during night time as well. The rigidity of the body makes it very difficult to adjust to extrinsic factors. So one needs to be mindful of the above mentioned risk factors. By targeting these risk factors, we can prevent fall in a person with Parkinson's disease. One word about Professor Benjamin Foundation. The foundation is doing an excellent job in taking the highly specialized care to the rural villages and areas where it is very much needed. Traditionally and culturally, doctors tend to remain in hospitals, within the corridors of the hospital. To take that care out to the people who actually need it into the remote areas is indeed a very noble venture that the Professor Maynard Foundation is doing. I would like to wish the foundation all the very best on this World Brain Day. Thank you.